Namaste everyone, good morning. My name is Aavashana Dahal, and today I'm representing HERD International here. As you can see on the screen, the title I'm presenting today is on infectious disease surveillance in Nepal with a focus on system integration and stakeholder engagement. This is what to be expected out of the presentation. Moving forward to the background. As we all know, infectious disease surveillance is a critical part of early detection of disease and its response. Although several surveillance systems exist, there is limited evidence on how they coordinate or involve stakeholders effectively, which affects our ability to monitor and respond comprehensively. This study maps out Nepal's key surveillance systems and the role of different actors within the current framework. Moving on to the methodology, to understand how surveillance system functions and interacts with each other, we systematically reviewed 3 key sources as depicted by the diagram on the left. So we focused on national policies and guidelines, surveillance frameworks, and programmatic reports here. Not only did this help us map out the surveillance structure, but also to analyze how these systems align with national and international standards. On my right, you can see the keywords that we've used. That's disease surveillance, surveillance system, and infectious diseases. The thematic analysis helped us identify the key stakeholders and their roles, and the outcome of this process helped us facilitate evidence-based decisions with government and their partners. Moving on to the key findings. Our review helped us categorize the types of surveillance systems currently in use, which are, as you can see on the screen, evidence-based and indicator-based. These systems fall under the leadership of various government entities. We've also listed down some key policy frameworks on the right. Although these are not all the frameworks that we have, these are some of the key ones that we've listed here. These policies collectively establish the strategic direction, operational standard, and coordination mechanism for disease surveillance systems. Moving on, as we can see on the left, these are the key disease surveillance systems that we have ongoing at the point. So starting from early warning and reporting system, that's the EWARS, surveillance, outbreak response management and analysis system, that's SORMAS, One Health and zoonotic disease surveillance, antimicrobial resistance surveillance, vector and entomological disease surveillance, influenza surveillance, as well as vaccine preventable disease surveillance. We do have some other, apart from the visible systems here on the screen, there are some other vertical surveillance systems like HIV, malaria, and climate-sensitive disease surveillance systems, which are working in coordinates with them. While working on these findings, we had a few challenges that we witnessed. So, despite being on the vertical side of the systems, the surveillance systems, there might be recording and reporting, there might be replicability of reporting and recording since there is the existence of the vertical systems. As we can see on the right, we can see that there are diseases, syndromes, and microorganisms under these surveillances. So you can see a few of the names are repeated here, which is caused, which we have concluded as some of the challenges within the system. Moving on to the key actors, there are major stakeholders identified with their key roles and responsibilities here. Hospitals are usually the first point of contact for individuals affected with the infectious disease, as you can see on the screen as well. So they are the first point of contact. There are 134 hospitals that act as sentinel sites under EWARS. They notify the RRTs, report to HMIS, and conduct RDTs. Similarly, the laboratories, which are the central labs as well as the provincial and hospital labs, they are also responsible for testing and quality assurance. Moving on to individuals and rapid response teams. At individual level, we can also report a lot of these incidences and case detections through our toll-free numbers, as well as RRTs investigate these cases and outbreaks and submit the reports. Similarly, moving on to government, there are local and provincial governments. While the provincial government bridges between the local and the federal levels, and oversees the sentinel sites and manage response coordinations. Similarly, the local levels develop disaster preparedness plans, manage RRTs, and ensure health facility readiness. Moving on, we continue with the key actors. We have Epidemiology and Disease Control Division, EDCD. As we very well know, it leads the infectious disease surveillance, policy development, and capacity building. Similarly, it oversees EWARS, SORMAS, HMIS, and digital surveillance. It also coordinates with RRT's mobilization, epidemiological research, and lab testing within PHL. Similarly, the Integrated Health Information Management System, although is a part of EDCD, is an entirely different entity on its own, which also strengthens the data validation and reporting mechanism. Similarly, federal ministries and development partners are there, starting from Ministry of Health and Population, MOLD, NDRRMA. They lead the policy, strategy, and resource mobilization, whereas our development partners support the capacity building, legal framework, and cross-sector collaboration. Although these responsibilities are presented here, some of these roles also differs by the surveillance system. For example, hospitals report each case multiple times vertically, which is also one of the challenges that we've captured throughout. Similarly, other key stakeholders, I apologize, there's been a small animation here, I didn't realize that. Other key stakeholders are the media, point of entry, FCHVs, digital partners, as well as National Statistics Office. So NSO, from our end, from the perspective of data, NSO has depicted to be a data hub among many presented here. So here we have also presented the role of NSO as a key actor. Similarly, on my right, that is the summary of whatever I just spoke about. Since the image was quite small, I had to elaborate it in a different way. So that's the summary of that. Now, moving on to the key takeaway. The study highlights the need for a unified approach to surveillance, leveraging existing systems and stakeholder networks to enhance early detection, response, and resource allocation, contributing to improved public health outcomes in Nepal. This study is also part of the Pandemic Preparedness Toolkit, which is an ongoing project of HERT International, which is focusing on creating an online platform where NSO and MOHP can collaborate together for pandemic preparedness and response. Thank you for your patience. That will be all for my presentation. Have a nice day.